And I'm going to start. Like I said, today was supposed to be about music, but the gentleman who was going to talk had problem. I mean, his wife was ill, so I just fit it. Talking about allergic rhinitis, and let me share the screen. And sinusitis, nasal allergy and sinusitis. Since we have American non-speaking in Farsi in the audience, I'm just going to have to speak in English. Thank you all for attending. Nasal allergies, you all heard, you all have, you might have. All right. Let's talk about the most common reason for nasal allergy. Anyway, the most common one is dust mite. Dust mite lives in our bedding, our pillows, our sofas, our closet. Why are they? They are very, very small microscopic insect, or that they are from the cockroach family. We cannot see them unless if you put it under a microscope, 300 times bigger than actually they are. They don't bite or anything. They're not but they were allergic to their feces. How do they grow? They are in a stuffed everything. They thrive on our sweat and skin debris. Then obviously they would have feces, and we're allergic to the feces because we breathe that. We must separate ourselves from them by covering the mattress, pillows, blankets, and all that with the specific fabric that I go through later on. Then there are the pets, dogs, cats, and cockroaches are usually in in the warehouses, supermarkets, maybe low-income houses, old buildings, warehouses. Grass is spring, pollens. Trees are summer pollens, and weeds are fall pollens. So we can see all year round, we can have allergen that causes trouble. The most difficult one is the dust mite. These are mostly seasonal, and of course the pet. I had patient that the husband was very allergic to cats, and he was hospitalized for asthma several times. Believe me. After he was hospitalized, with discharge him, it was the night before Christmas, he had to go to a hotel because the wife wasn't going to get rid of the cat. And we're allergic to cat saliva. So even if they got rid of the cat that day, it didn't really work because their saliva is everywhere. It's very difficult to get rid of the cat saliva unless if you wash everything. Then that would go take care of it. So this is also a very potent allergen. This guy and this guy, they live with us. This is a normal sinuses, normal nasal cavities. Everything comes to the nasal cavity. The tear ducts, the ear drains here, sinuses drains in here. It's clear as this color. Then we have frontal sinuses, ethmoid sinuses in the back, and maxillary sinuses in front. Why we have sinuses? They are empty bone cavities. They act and practice. It's just like an airbag in the car. They prevent our brain from the impact. So if we have a facial pain, impact or head it prevents the brain to shake and damage. That's the problem. That's the reason we have the sinuses. And then the sinuses have the same lining as the nasal cavity. They all, have secretion. They drain here. If we have inflammation and have problem right here, the sinuses are going to be blocked. The fluid is going to collect here, just like a swamp or anything that the water doesn't drain. It's going to be infected. The ear is also going to get involved. So this is a normal look. Now I'll show you the next one. This is how it looks like when there's an allergic rhinitis. The color is pale because it is swollen and there is a secretion running everywhere and including inside the sinuses. So this is the typical look of allergic rhinitis. When we look at it, we know right away. The symptoms, most of you know about it. 10% of Americans have allergic rhinitis, runny nose, nasal congestion, sneezing, itching, postnasal drip. And of course, if it's a seasonal, it's worse in whatever season, whatever pollens of weeds or grass we're allergic to. But if it's a household problem, it's all the time. Now, if that allergic rhinitis continues and continues, it's going to cause and create nasal polyps. These are tissues that they're extra worked and basically they are nonsense tissues that they are useless. And the only problem, the big problem they cause is the obstruction of the drainage of all sinuses. The infections are worse. If you do go to surgery and they take it out, it's going to grow back because the foundation of the problem is still there, which is the allergy. And so sinus surgery is not always 90%. It's not the answer to sinus problem. We have to take care of the base problem, which is inflammation. Now, how does this work? Imagine if this is the cat allergen, we inhale it. This is one of the white cells. It's called eosinophil. And the white cells are capable of making receptors that exactly fit the allergen. If this was a pollen allergen, it would be a different look. This area would be different size. So it's like a lock. It just locks itself. And it becomes mast cell. So when it's saturated, when all these mast cells are saturated with different allergens, see they're a different look, this is what's going to happen. This is 1999. Exposure is happening here because the pollens came here. It came to the nasal cavity and now mast cell is complete. The following year, let's say this was year 2000, the same pollen comes here, mast cells is all saturated, but the next exposure cannot tolerate it, cannot recept. The receptors are not there anymore. It explodes. Then it puts histamines and other chemicals out, and we have symptoms. So this timing can happen when you are 3 months old, or it can happen when you're 30 years old. And patient says that I've never been allergic to shrimp. Well, yeah, but now your mast cells are saturated. They don't have any more receptors to capture the shrimp. So now you are, because it all depends how many mast cells are captured and saturated by so many allergens. In allergic patients, people, the mast cells the numbers are high, and they're very sensitive, and it's very easy they all be occupied. The antibody that it's here, it's called IgE. That's what we measure in the blood. This indicates you're an allergic person or not. If you have allergic rhinitis, like nasal allergy, his IgE should be high. If it's the other kind, which is vasomotor rhinitis, the IgE is normal. Now, what's the vasomotor rhinitis? It is reaction to cold temperature, cold and hot, wind, perfume, chemicals. You're not allergic to something that has protein and is measurable and is testable. Household products, that's vasomotor rhinitis. But the symptoms are exactly the same. The treatment is a little different. But the beginning, the symptoms are exactly the same. If a person has same symptoms of allergic rhinitis and then IgE is negative or is very low, and they say this is or a skin test is negative, they say this is a vasomotor rhinitis. So you have to be careful of when you're going from a hot shower to a cold room. That's the problem. Or protect with the wind blowing, hairspray, perfume, household cleaning product. You have to avoid them. Another way of helping would be a HEPA air filter, high efficiency air purifier at home, so it captures all the other chemicals that is not right for you. Next, okay, here is when all the mast cells are released and is entering the cavities and all the symptoms start. It's starting. Dust mite, we talked about it. The way to get rid of the dust mite is we have to separate the dust mite from us. That's the only way to do it, is with a very tight cotton that they're really woven together extremely tight, and you cover the mattress. It has a zipper. Basically, the mattress goes in this zipped bag. Same with the pillow, and they also have blankets and other covers. Now, when this happens, when we separate ourselves from dust mite, our sweat and skin debris does not get to them, and so they cannot thrive, and then their feces cannot get back to us. But that's the only way. Now, this is about maybe 30 years ago, this product came out. The best one are the one that they're more expensive, just like anything else. If it's a cheap one that you get from wherever, it's not woven very tight and right, it's a waste of money. It's not that expensive. I think the pillow used to be about $10, $11, the pillowcase each. And every 6 months you can wash it. And then after you put the pillow in it, then you put the pillowcase over it, or whatever decoration you want. If someone is allergic to dust mite, they shouldn't have too much stuff in their bed, like extra decorative pillows, very fluffy, big, feathery blanket, or the kids would have too many stuffed animals. It won't work. It would have more dust mites. For the children, so the room should be kind of a sterile, your bedroom. The children, we don't want to deprive them from having their favorite teddy bear. We would have maybe 1 or 2, and you can put it like once a week in a plastic bag and freeze it on the freezer, because the dust mite would die in a very cold temperature, and also temperature of 140 degrees centigrade. No washing machine in the United States is that hot. It's not 140 degrees. But you can freeze the little teddy bear and then wash it and use it. Once a week, those stuffed animals should be washed. So a kid with allergic rhinitis or asthma, certainly for asthma or sinusitis, they should have very little stuffed toys. They can have wooden toys and other. So this was about dust mite. Now, what do we do? First, after this lecture, hopefully we take care of our own environment as much as possible. And there are over-the-counter medication you can use. The first one is a nasal wash, that there are different gadgets that they come. And it's all available. Costco has all kind of nasal wash with gadgets with a saline, and it's should be washed the nose maybe once a day at least, either like after breakfast or before right after dinner, but not before bed because the fluid might stay inside the cavity and that bothers. And the best time is to have it done after you take a shower, in the shower, because with the shower and with the steam, the nasal cavity opens up. There's a little drainage comes in, postnasal drip drops, and we will have better open nasal cavity so it can be washed easier. And over-the-counter medication, now most of them are available. Benadryl is a very good antihistamine, but it makes you drowsy. So if possible, has to be taken at nighttime. And Zyrtec, Allegra, and the rest of them, Claritin, they're all daytime, that now they're available over the counter. One a day is enough, usually. If you don't get better, you talk to your primary care physician, they can recommend recommended better prescriptions. And if nothing is helping, then we go to the allergist. And allergists ask you a major history, and what they can do testing. The testing can be done in blood, and the best is actually skin testing. The blood test is expensive and it's not as accurate, very expensive. And the allergy testing on your skin is very simple to do. It's a little plastic scratch with almost like a toothpick kind of look. It doesn't hurt. 3 days before the skin test, we shouldn't take any kind of antihistamine or a nasal antihistamine because it blocks the reaction. And the allergist does that on your back or your arm, and they wait 20 minutes, they read it. If there's any inflammation around the, let's say, cat, dog, dust mite, grass pollen, which, mold, they tell you you're allergic to this. If they have to go to allergy immunotherapy, allergy injections, then they have to do more detail of testing of, let's say, grasses, exactly say which family of the grasses is involved. And that's something that allergists would do in their office. Usually it takes about 1 year to be stable after the allergy shots started, because they cannot start with the high concentration. It has to be diluted, and then we test your body, your skin, to see which dilution we have to use. 1 in a million dilution, 1 in 100,000 dilution, which one? Whatever you can tolerate, then they build it up to the concentrated one. When you get to the concentrated one, it can be 6 months, it can be 2 months, but definitely by 1 year, a person should be on a concentrated one. And then it becomes once a week, then every 2 weeks, and once a month. And once a month getting shot is not a bad idea for stopping all the symptoms. And the treatment is the one we just talked about it. Seasonal allergy, obviously the title says what it means. It's only spring or fall. Dust mite control is a must to do. Now, usually probably on Google or everywhere, but the newspaper used to write the pollen and mold counts every day, and I'm sure they still do it. Especially during the nighttime or a couple hours before the night, you've got to close the windows to your bedroom because that's where we spend most of the time, so the pollens doesn't come out. You take a shower, wash the hair, and change the clothes after you come home. If you or the kid are running and you're allergic to to grass pollen or tree pollens, and then someone with my hair would just trap all the pollens, and I come home and I don't wash my hair, I go with it to bed, obviously I'm going to have problem all night. So it's highly recommended when you come home, if you have pollen allergy, wash your hair, your nose, change the clothes before you go to bed. If you're mown in the grass, obviously, you wear a mask. And you can take the antihistamine, the HEPA air filter, the high efficiency particle air filter. The best company is Honeywell. It's the size of a, I don't know, how you all probably have a rice cooker or something like that. And it's portable. A person can have it just in your bedroom, and you turn it on for like 2 hours before you go to bed, windows and doors closed. It makes a significant difference that how lighter and cleaner the air is. It's not as heavy as it before. And the filter has to change when the red light comes on. The filter is charcoal, is black. When it's used, becomes gray and has to be changed. And the filters are available everywhere that they sell them. So these are basically your job, and it works better than seeing any allergist and all the shots and that. After you do all these, you do nasal sprays, everything else, you're still having problems, especially if you're having chronic sinusitis, then you see an allergist. This is one of the sinus rinses. This person came out, this doctor, he's a pulmonologist, he was in Fresno then. Neil is his son's name. We all used to wash our nose with, we used to tell the patient, make a solution of 1 teaspoon per cup of warm water, which is not chlorinated, and put, salty water and wash your nose. But this smart person came out with this gadget. It's very soft. It's very, very soft. Put the water right there. A package of a salt and baking soda comes with it. If not, you can do it, put it yourself in, and wash the nose daily, maybe morning and night. I prefer to be done in the shower when you are, and then shake your head down because the fluid goes there and it needs to be drained out. This would be, it's like if your hand is allergic to whatever, don't we wash it? We definitely wash it. And also in our nose, we have brushes, very fine brushes, that it holds the particles. So it needs to be washed out. This is one of the nasal allergies spray, which is the topical cortisone. It doesn't really get absorbed systemically, but some people might be sensitive to it and have nosebleed. If the nosebleed happens, you stop it for 2 or 3 days, put some Vaseline, and then you start it again. There are also other nasal sprays of the same family, different company, and also the antihistamine nasal allergy. I really like this one. The only problem with it is it has a bitter taste. When you use it in your nose, your tongue, it's really bitter, but it works very well. The combination of these two are also available by prescription, and it's very expensive. Now I go to sinusitis, and here again is the nasal cavities. Very clean, very pinkish, beautiful, everywhere is open. If you can see this area, see how small this sinus drainage is to this nasal cavity. It's very, very, very thin, very small area. If it swells up, there is no drainage from sinuses to the area, to the nasal cavity. If we keep this area clean and needed to be medicated, then obviously the drainage would come out and we don't have infection. We have sets of sinus, about 6 sets of different sinuses everywhere. Again, it acts like an airbag to protect our brain. Lateral view of a normal nasal cavity. These are turbinates. There are 3 folds. The reason this is created by nature in our nose is to increase the surface area, to clean up the air that we are inhaling. Because as I said, they all have brushes. When there's a fold, you increase the surface area. So it's like 4 or 5 times more than just one area. And this area has capacity, or it's able to filter the air before it gets here. And obviously, with whatever is in the air, it's easily bothered. Sinus cavities, frontal, sphenoid, then the ear drains down here. If there's a lot of secretion here, we have post-nasal drip. And that's when we constantly clear our throat. So that's one sign of post-nasal drainage. And chronic cough, it causes chronic cough. Nasal polyp, overactive or overreactive tissue of nasal cavity and turbinate causes this bubbly look. And obviously they cause obstruction and they need to be taken out, but it would grow back if you don't work on the base problem. Before they take it out, nasal steroid, maybe with a higher concentration, can be used, and it would take care of them and get rid of this bubbly looks. So this would be like wash, HEPA filter, dust mite control, and stronger nasal allergy in sprays, maybe add antihistamine with it. We don't want to go to surgery because it doesn't get as good as before. So fluid, when it just sits here, like anywhere else, it becomes pussy. It's infected. Fluid builds up, blockage happens. These are easy, it drains easier. Imagine those other little sinuses up here or under the brain and this very small one. They don't drain well. If you only use antibiotic for sinus infection, there's bone around sinuses. Bone doesn't have a good blood flow. Antibiotic has to get to the blood system, through the vessels, get to this area. Because it's a bony area, it's very hard to get to this. So the best is to open it up with the work you do. Steam 2-3 times a day, just hot water steam, and wash a couple times a day, nasal sprays. This area has to be drained. Just like if there was an abscess, it has to be cut and drained out. If the area, because of constant inflammation, becomes a scarring and nothing is coming out, then there's a surgery. They would go in, they would drain an extra hole here connected to this area. They try to open that and then drain it out. But we will try to do everything that we don't get to the surgery. That's the job of the allergist, to avoid going to the operating room. But if it's needed, it has to be done. These are easy surgery rather, but the small one and the one under the brain, they're very difficult because the coverage, the bone coverage between the frontal and ethmoid sinuses and brain, it's very, very thin bone, and it can break down very easily during surgery. I have one of my own friend that during the surgery at UCLA, actually, this opened up and she was miserable for 20 years. They suggested this would be patched with the bone again. She didn't want to go through that because it's, you're touching it on the brain. So it's not that easy. In children, sinus infection should be taken seriously because even this bone area is very, very, it's like almost a onion peel. It's very thin. And I've seen several times that because of sinus infection in this area, it broke through and gave brain abscess and the kid had convulsion. And in the workup in emergency room, they obviously always would do MRI or CAT scan of the brain. And it was just the brain abscesses because of sinuses. So it's pretty serious in kids. It should be taken serious. This is full sinusitis, which we call it pansinusitis, pan like everywhere. Look, maxillary sinusitis, this ethmoid, the small ones, very difficult to operate on these guys. The drainage is just not going to happen. So we must do our best not to get to this pansinusitis. Asthma, it's disabling. Asthma has mortality. Asthma is a serious illness. If you don't take care of it, it can be fatal. In this country, we have about 5,000 dead trying to run to emergency room with asthma. So many people, millions of people have asthma. The quality of life is lower because of difficulties in running, functioning, school, missing work. This is a normal lung. The tissue is this nice color. It's all open. These are bronchioles, which is a continuation of the nasal drainage and cavity that it all comes down here. Through our throat, the throat would be this area, pharyngeal area, nase would be up there, and then it comes down. Bronchioles, these are the large ones. There's muscles and cartilage. This is the trachea. Inside of it, again, very beautiful lining with cells and also, again, brushes. And this trachea becomes branches, just like a tree. At the end here, we have alveoli, the cavity, like they're like grape. That's where oxygenation and oxygen and CO2 exchange happens. This is normal. Air comes in here, oxygenated blood comes there, carbonated blood gets out, goes to the right heart. Now, what is asthma? Is reversible hyperreactive airway. So the airway it's hyperreactive. It reacts to, let's say, smoke or cat pollen antigen or wind or Clorox. It reacts to it. Not in everybody, in people that they are sensitive and they are asthmatic. So it's hyperreactive airway. When it does happen that, the muscles tighten. They just grab and this area becomes tight. But it's reversible. If we, on time, get rid of whatever it's the allergen or the irritant, and also if needed, there's certain medication to be used. We have seen people carry inhalers with themselves, let's say albuterol, Proventil. It opens up these muscles. When we were residents, we used to give them in emergency room, of course, adrenaline. In emergency room, the treatment is a little more aggressive. So it's reversible hyperreactive airway. We want to reverse it, but not too late. Because if it's too late, that's when the death happens. Why death happens? Because this area becomes so inflamed that there's no way the air can go in. Also, in asthmatic, when the air goes in, it doesn't come out. So this area of the lung, half of them has a residual air, like there's a dead air sitting there. This is normal alveoli, normal bronchial, that you look at inside the lumen, beautiful lining, very clear color, muscles are fine, they're not tight, cartilage, just perfect normal bronchial. Now, when in asthmatic, this area becomes kind of meaty and there's no air in it. Reverse that. And there's mucus here. It's not clear. There's a spasm in this area. So all of them happen all together. Mucus is big trouble. The spasm, it can be reversed, but on time. Look at this asthmatic one. It's inflamed mucus. Mucus gets dry. It's hard to get it out. And muscles are tight. The drainage is really tight. Inflammation of the mucus. There's just air doesn't go in. You cannot even intubate them or put a tube in because it won't go in. So that's what unfortunately that happens. At this point, obviously they have shortness of breath, severe shortness of breath, coughing, and wheezing. Wheezing is when the air goes in, but it doesn't come out. We hear that whistle, like the air goes in, it's trying to get out, it's going to make a whistle noise. The symptoms, cough, especially nighttime, exercise, laughing, because laugh is also exertion, shortness of breath, chest feels tight, like something is sitting on it. Wheezing is when the doctor hears that, and asthma can be deadly. We don't want it obviously be there. What causes that? Everything that irritates the airway, this area. Exercise, not in everybody, but in some people, exercise, you inhale the dry air, it gets dry in the bronchioles, and it causes the same problem. Stress tightens the muscle of the airway. Sudden weather change. You come from a hot shower to a colder room. And also, especially in adults, the gastroesophageal reflux. A sudden asthma symptoms in adults, either it's GERD or acid reflux, or could be tumor in the lung, or something surgical might be going on. So it's not taken simply easy. Exercise-induced asthma, it happens when a person is running, biking, much less in swimming. And when you swim, the top of the water is moist. We need moist not to get that dry secretions. But if you're running and biking and the dry air goes in, people who are asthmatic, they would have more drier secretion, and it causes all the other symptoms to back up with it. The treatment is very simple. Now, when they go to the doctor's office, the lung function is done to either their internist, general practitioner, or the pulmonologist, allergist. The lung function is done, and it shows it's basically normal in exercise-induced asthma because it only happens with exercise. In the other patients that they are wheezing or they are having symptoms, their lung function is not normal. It shows that there is a residual air sitting at the bottom of the lung and it's not exhaled. If anyone has asthmatic symptoms, the best is try to empty the air, the residual air from the lung. So it's a very prolonged expiration. You inhale and then you exhale very long and hold it and force it out. So all the dead air comes in. Then it opens up the lung and then the new oxygenated air goes in. That is the best. So for exercise-induced asthma, when we make the diagnosis that my kid only, can't run 20 minutes after, run, or 10 minutes after they run, they start puffing and puffing. The best is 20 minutes before exercise. Use a bronchodilator, which are the spray. Samples of Ventolin, albuterol. It opens up the airway, but you use it 20 minutes before the exercise, and it keeps the patient healthy. Their lung function is normal. Oh, this we talked about it. You take the exercise, and the symptoms could be the same: cough, wheezing, chest tight, and the kid stops running because he says, I can't run. I used to go on behalf of Torrance Memorial, they used to bring the kids to Torrance Memorial area or occasionally send us to the school. When we did the breathing test on a normal, so-called normal kids, there are plenty of them had mild asthma, or if you run them, and they had exercise-induced asthma. So it's common, it's more than what we think. The treatment, avoid whatever causing your asthma. If secondhand smoker, walking to a place that someone had a cat or dog, dusty area, hair shops, nail salons, anything that is irritant, we need to avoid that area. Short-acting inhaled beta agonists or anticholinergics. They are fancy names for two different inhalers that it opens up the muscles of the bronchioles and the trachea, and also it decreases the secretions. These are used maybe once or twice a day for occasional asthmatic. But if a person needs twice a day an inhaler to breathe better, then definitely need a lung function, or they call pulmonary function, and measure and see if this is a chronic case, not just once in a blue moon. If it is chronic, then we need a long-acting beta agonist, which keeps the muscles open. We add inhaled corticosteroid to it, to that inhaler. And at very seldom occasion, we have to add pills of the cortisone or cortisoid or steroid for a few days. Another very, very good medication is called Singulair. This is anti-interleukin. This one, it helps the mast cell not to erupt. Remember at the very beginning, we said when our white blood cell is exposed to foreign antigen, then it becomes mast cells, and then when it's saturated, it bursts. It controls that burst. It's a very good medicine. It's even approved for pregnant ladies and small children. This combination is for someone with chronic asthmatic, and they're usually controlled. The oral corticosteroid is not used on everyday cases because hopefully we do everything so we don't get there, because steroid has a lot of complications. Now, the latest one, the best one is monoclonal antibody injections. This is the state of art for almost everything now. They make antibody against that IgE that we talked about it, that immunoglobulin E, that it's high in the patients with allergy. We block it. These are like, it's just unbelievably effective. It's done in allergist office or anywhere that they can resuscitate the patient in case if the patient has major allergy reaction to it. Doesn't happen. I didn't see it in many, many years at all, but it can happen. So the patient It's an under the skin injection, very small amount. How much do we give? It depends how high is their antibody level, their antibody to the allergen, the IgE level. There's a formula we calculate, and it's approved by almost every insurance company and Medicare. It wasn't in the past, and it's very expensive, like $1,500 a week. But now it is approved. But it has to be done in somewhere that they can get you out of it, trouble if you get in trouble with it. If asthmatics are seen by an allergist, and then what the allergist does, it just figures out what you are allergic to and how you can prevent it. And specifically, it goes and figures out if it's a grass, and then they immunize you against the grass. So patients in general, asthmatic patients that they have seen the allergist and they've been immunized and desensitized, they have 65% less symptoms, emergency room, and quality of life is much better. Let me turn the lights on, and then we go to the questions and answers.